Greetings to everyone viewing this presentation. My name is Dr. Alvin Chitterman, and today I'll be presenting to you on overweight and obesity. So this is the outlines of today's session. We'll be looking at the background of overweight and obesity. We'll look at how these conditions are acquired. Then we'll look at the individual and population effects of obesity. Who is considered to be high risk? What are some of the prevention strategies? And I'll highlight to you an overall concept map of everything that was discussed. So according to the Mayo Clinic, obesity is a complex disease associated with excessive amounts of body fat. The World Health Organization defined overweight and obesity as the abnormal or the excessive fat accumulation that presents a risk to one's health. Now, when I refer to obesity, I'm considering persons that have BMI greater than 30 and overweight a BMI between 25 to 29.9. So I'll show you how to calculate this BMI in a few slides. Keep in mind that the rates of overweight and obesity continues to increase in both children and adults in the United States. So this is a significant public health concern. So let's look at the prevalence of overweight in persons in the US over the past 20 years. The number of overweight US children has doubled. The number of overweight US adolescents has tripled. Who is considered to be high risk? Mexican American boys and African American girls are considered to be high risk. The average American adult is more than 24 pounds heavier today compared to the 1960s. Now let's talk about the prevalence of obesity in the US. Previously, we just looked at the prevalence of overweight. Now we look at the prevalence of obesity. Now, children and teens, these are persons between the age range of 2 to 19 years of age. 19.3% of them are considered to be obese. Adults 20 years and older, 42.4% are considered to be obese. So that's a significant proportion of the population that is considered to be obese. Obesity increases with age. So as someone ages, their muscle mass decreases and your body fat increases. Who is considered to be high risk for obesity? Hispanics and the non-Hispanic Blacks. So how can one acquire these conditions? First of all, I would like to define to you the meaning of the energy gap. Energy gap is the imbalance between the number of calories consumed and the numbers expended. So in other words, persons are consuming more energy than what they can burn in respiration. Here I have 5 factors that can influence one's body weight. Lifestyle, for example, if someone increased the consumption of sugar sweetened beverages or they increase their fruit drinks intake like sodas and eat a lot of fat-laden snacks, then this can increase their body weight. So in other words, they are consuming more calories and they are burning less. If they have decreased physical activity, it could increase in their body weight also. Persons with low socioeconomic status is going to affect their neighborhood. Usually these neighborhoods would have increased fast food outlets, and these fast foods are energy dense food. So again, they would be consuming more than what they can put, what they can burn. Your low socioeconomic status is going to affect the school you attend, which eventually is going to affect your job. And so you may only be able to afford food that are cheaper, like fast food. And again, it's affecting your diet. Genetics, certain genes has been implicated in obesity. Certain medications can cause obesity or increase body weight. So medications like antipsychotics and diabetic medications can increase body weight, and even steroids. And persons use steroids for numerous reasons. So all these things could increase one's body weight. certain disease like Cushing's disease or Cushing's syndrome, this is associated with central obesity. So these are many factors, that could influence someone's body weight. So how can one determine the body fat? One of the most common methods is your BMI, which takes in consideration your weight in kilograms and your height in meters squared. When you find the ratio between the two, you find your BMI. Here I have a link, you could click on it and determine your BMI. Keep in mind that BMI is not an accurate measure in children, so we use percentile in children, and in adults sometimes is not accurate depending on the individual. So for example, someone who has increased muscle mass would have increased weight and lead to an increased BMI, but that doesn't mean that they have increased fat, body fat. So this is the World Health Organization classification of BMI. So less than 18.5 is considered to be underweight. 18.5 to 24.9 is considered to be normal weight. 25 to 29.9 is considered to be overweight. Once your BMI is over 30, you're considered to be obese. So we have class 1 between 30 to 34.9, class 2 between 35 and 39.9, and class 3 greater than 40. So how does obesity, what are the influences of obesity on the individual? So obesity could increase high cholesterol and triglycerides, and that would increase one's risk of heart disease, stroke, type 2 diabetes, and certain types of cancer, and also increases your risk, especially if you are a male and you're overweight, right? It increases your risk of sleep apnea. Persons who are obese, they are 6 times more likely to develop type 2 diabetes compared to persons of normal weight. Obesity could lead to mental health issues like depression, and of course, that would decrease your quality of life. So it's not only affecting the individuals, but obesity is also affecting the population. So we just look at a number of obesity-related conditions. So we have an increase in the variance of disease within the population, increase in the morbidity and the mortality. And again, that could affect your productivity because the more conditions you have, you would have to make more doctor visits. You may not be able to move as you would like to. So your quality of life is going to decrease. And as we just saw, it's associated with depression, etc. Now, the estimated annual cost of obesity in the US was 1.47 billion in 2008. And it is expected that this number would increase from 2008. But this is the latest statistics I found. So who is considered to be high risk? Persons that has low socioeconomic status, we already established that. Persons that have positive family history because of their genetic makeup. Environmental risk factors, like depending on your neighborhood, we already discussed this, certain medications, and persons with certain medical conditions like Cushing's disease and Cushing's syndrome. So how can you prevent obesity? So first of all, you would like to screen, so get an idea of your weight, where you fall, whether you are underweight, normal weight, overweight, or obese. Now, since it is caused by an energy imbalance, you would want to avoid fast food and adapt a healthier eating lifestyle, eat more fruits and vegetables, as we can see a nice diagram here with many fruits and vegetables. You would also want to limit inactive lifestyle and do a lot of more physical activity, increasing your physical activity, maybe 30 to 45 minutes per day, activities that can increase your heart rate, can make you sweat. So these are all behavioral modification because obesity is a preventable disease. So here I have a concept map, many causes of obesity. What are some of the health issues we spoke about? How can you determine whether or not you are obese? Or we have to approach BMI with caution, the cost in the long run of obesity, and how we can manage obesity by screening, adapt a healthier lifestyle, and by exercising. I thank everyone for listening to this presentation. If anyone have any questions, please feel free to email me. And I thank you for viewing. So do have a productive rest of the day.